All right, I think we have a few more people that were able to join us today. Again, thank you everyone that took some time today to join us for our webinar, which will be talking about personalized content and of course, modular content as itself. My name again is Leo Sanchez. We're gonna get started just right now. If anyone joins us afterwards, we'll be able to share with this, but let's get started again. Hello everyone, and welcome to our webinar. As I mentioned before, we're going to be talking about the art of personalized content in pharmaceutical marketing communications, and as well as how modular content creation and management can be used as a palette to handcraft customer experience for the audience. Before we begin, as I mentioned before, we are going to record this video so that you can have it for your consideration after our presentation. In the meantime, for anyone that had joined earlier, feel free to submit your questions at any point during the webinar, even before now, before we get started, so that way at the end of the session, we are going to run a Q&A where we'll be happy to answer any of your questions. Also, we do this sort of webinars on different topics around digital transformation for pharma regularly, so any feedback is important to us. So don't hesitate to fill out the exit survey so that this will help our organizers make all future webinars even better and more tailored to your needs. Let me introduce myself. Unfortunately, my colleague today, Helen, could not attend. My name is Leonardo Sanchez. I'm the account executive here in the American regions. And let's talk a little bit before we get started. Some of you guys may know who we are as Viseven. Some of us are still not sure of what Viseven is. So I would like to kind of talk a little bit about what Viseven is. And Viseven Group is a global tech service provider, which working with dozens of top 50 industry leaders in pharma and life sciences. What we do is combine marketing and technology expertise with strategic capabilities and turn that into tailored marketing operating models that at scale involve omni-channel customer engagement, infrastructure, content excellence, and much, much more. The hallmark of our approach is creating bridges between strategy and operations. And instead of simply providing technology, we focus providing solutions that happen to involve technology to facilitate operations, including working in multi-vendor environment. But enough about ourselves. Each of one of us is here for a reason. So we'd love to understand you for a while. Well, we've got a quick question for you. What issues are most notable for you and your company when it comes to creating and distributing global content to a local market? What would you like to improve this new year? I know last year, most of us were thinking about taking this new year as a new transformation for our digital content, but what exactly would you like to work on? If you don't mind, we'd love to hear your ideas in our chat, so that way we can start addressing them as we're having the presentation. We'll just give it another couple seconds. We do have a few questions already written on here, which is great, talking about modules and final materials, understanding MLR approval. Great questions so far. Personalized omni-channel communications, great. Thank you for that, Angelica. All right. Navigating regulatory approvals, very big problem. Align process, great. Awesome, and luckily we are actually going to be touching up on all of these topics. And if for whatever reason you would like to know more information on some of these topics, I would love to talk to you guys after our webinar, but I'm really confident that our webinar is going to touch base on all of these topics right here, understanding modular content and how to use it. Great, so let's get started. So what we've got is our experience as Viseven. Most of these issues are due to the combination of several factors, which could be. So as Viseven, we've talked to our clients, we've talked to our contacts, and these are the things that we've kind of noticed. Brand strategic communication consistency. Between the global content, it's only supported to limited extent, while the countries pretty much have to do what they must to localize that content to engage with their HCPs. There's hardly ever a consistent content reuse strategy. And no, by reuse, we don't mean copy pasting, but really having the materials in one place. Well, everyone knows what they can reuse, how to do so, but also what restrictions are in place for the same look and feel for brand awareness. Accordingly, there is often no unified format for content tagging or metadata. The multi-vendor environment is one of the biggest struggles. With so many different agencies that work within the content, these agencies are not synced and work with their own flows for different brands. A similar problem exists. So pipeline management is really what many customers needs. And of course, as I see some of our questions already, MLR approval is always long and tedious process. So meanwhile, if you think about for a moment, establishing a productive dialogue with the audience, with the customer, is really a kind of art. You essentially draw the portrait of your customer based on what you know about them, their needs, their preferences, their favorite color, and reproduce it with the brand and value in the picture. In terms of content, the process often looks like, okay, I have an understanding of what to tell and show the HCP or patient. Like this picture, we may think, here's the head, here's the curtain, here's the chair. Now translating into marketing messaging again, that corresponds to message 1, 2, and 3. Suppose you have some content items you can operate with. So you try to fill these slots with what you have, a presentation, an approved email, e-detailing, e-remote tailing, especially with COVID right now, whatever it could be. But the result can sometimes be, well, like this. If you think about it, where technically seems to be no problem. After all, the picture has the head where it's supposed to be, but the actual problem is it does not match. I'm not sure if anyone has seen this movie. I know it's a little bit older, but one of my favorite scenes in this movie. So let's get back to this. So there's a change of cause and effect, right? Engagement may be lacking because there's still not enough personalization. Personalization in turn fails because there's no single standards. There are no standards because the general approach is typically too simple. Create long-form content without the possibility to effectively update, adapt, or fragment it. And at the bottom of the pits is the fact that the stakeholders and the processes behind content are not aligned in the way that allows for personalization at scale. I feel like this is where modular content, right, is really the key to this. So the main problem, we know and repeat time after time that all customers, all HCPs, all patients are different. Their picture of the world where we want to implement our message is very, very different. And yet existing content is simply copy-pasted to cater to different target audiences. That leaves you with an enormous amount of content to create, manage, update, and deliver. Personalization using old content tools and methods don't scale. Delivering personalized content at scale requires an altogether content ecosystem. Pharma is tossing old content into new tools and expecting those tools to completely solve the problem. But to successfully personalize content at scale, we must rethink the content itself. So what's the solution? To create nimble, reusable pieces of content that can be combined in different ways for different people and different devices. To enable these chunks to be automatically combined to create the experience a customer needs when they need it. Like the Mona Lisa. You need elements like the mask and backgrounds that are easily inserted without distorting the image. Like a PNG file, which actually transparent background and not just white or checkered board pattern. Once the content functions in such units, you can establish a scheme when it's customer, the HCP in our case, who define and dictates what content they receive with your message and value. There can be journeys, personalized content, decision-making communities, and loads of data for your organization to use and make sure you keep producing the content that you really need. Again, when, where, and how the HCP wants and needs this. At the same time, such content units will need to allow for combinations of two factors. The tech side of the deal, where you produce and disseminate content efficiently, and creative storytelling based on such units in different combinations. So this is where modular content enters the picture. Many of you guys have heard it by now. I know this was a huge topic last year. I know some of us are already talking to understand modular content, and it's really the next step in the digital transformation for not just pharma, but for the whole world. As we know, we're continuing to be in this digital world, and it's not going anywhere. So we have 5 components of efficient digital. In essence, modular content is the response to common challenges and needs. Feedback and steering to maximize your ROI, which means closing the loop and linking global strategy with local tactics. Acceleration of content production. Having that flexibility to respond to HCP's needs when, how, and where they want. I love saying that over and over again because it really is how we can personalize the delivery of our content. The demand management, allowing the content to be delivered fast for different channels, customer journeys, or contexts. This is, again, where modular content comes into play. Integrated channel mix, the proper integrations to orchestrate all of our digital content across all of these channels. And rigorous personalization. We have the tools. There are the tools after this, the technology. So using that AI and the best action tools to deliver those communications and have that one-on-one experience for each of those HCPs. So how do we get there? Many people somehow thinking adaptive modular approach is a disruption, an evolution. In reality, it isn't. That would be kind of crazy, right? In Viseven, we facilitate projects. There is a definition stage, followed by central execution of the MVP solution. You can make the estimation of resources needed for scaling in the future, align with content agencies, create templates to execute, and only do this at scale. So the best part is wherever you are in your stage of your digital transformation, you can get started on modular content. Don't be scared of it. Apart from obviously creating flexible content modules, it also is important to ensure content visibility, tagging, tracking across channels. This is in turn going to help us understand what modules to produce. At the same time, customer centricity is an important thing to keep in mind, as well as ensuring that the process is run exactly in the way to produce more content faster. For many, this is the central thing about the whole modular concept. The outcome of the approach is that 2 factors allow to unlock the door to the HCP. First, having content centrally governed in one single store with timely updates and possibilities to reuse. Second is having a proper content architecture in place. Permanent, correct labeling and tagging of each content piece ensures the reuse and delivery of the right content to the right person at the right time and relevant channel and device. Again, going back to when, where, and how. So rethink the term reuse. In this way, you can create a current modular content unit once, have it stored in a digital asset management system, approved there in its own right, translate it for local markets, and then once you need to update it, it's updated once in every item it's ever been used. For example, let's suppose we now need to give the Mona Lisa something to hold. In traditional contact approach, we would have to go around and replace it manually everywhere and inform people and so on. But modular makes it much easier. This allows for the assemble of deliverables quicker, automate omni-channel publishing, eliminate duplicate efforts of reduced desktop publishing time, communicate solid message in the same way around all channels and markets, and prevent content drift and copy-paste errors. This in turn enables data excellence. By having the possibility to analyze the performance of each module, you collect information from the HCPs, monitor, collect data, and with a proper system in place, you can even automate it to draw the proper pictures, the proper content for them based on this data. So how does this look like in practice? This all sounds great, but how do we actually put this into practice, right? In terms of implementation, there's this evolutions of simply going modular to having the content structured. Modular content is componentized and designed for reuse and related business process optimization. Structured content is both human and machine done. You also make the content rich. Structured content can be labeled and consistently organized with machine readable information that describes the content metadata. At the same time, content reuse involved existing content components to develop new content. And finally, you get content in this channel and format. Format-free content can be mapped to any output channel or device and can be reskinned automatically. Our technology solution to achieve this is our 𝐸-𝐳𝐧𝐿 platform. So as we were speaking before, not only are we focusing on just the technology that's going to go in and fix your content, it's a whole process. Having the right right tools, the right strategy, the right mindset. And this is our this is our technology, our 𝐸-𝐳𝐧𝐿 platform. The brand content centralizing planning, briefing, authorizing, management, and automation suite for the enterprise level customer that helps to develop enriched digital content for consumption across multiple platforms and channels. And it's empowered by ML and IA auto tagging engine. In this way, we create templates for each channel. Note that unlike modules, templates are channel specific and can fit modules. This provides economy of effort, consistent look and feel, as well as a higher content reuse. Content management governance is also important, and it takes forms, devoted teams, and processes. Finally, there are specific benchmarks to meet. The key components of this approach are thus channel-specific templates, components, modules, and blocks, and the metadata used for auto-tagging of the content. So let's look a little bit more at what a potential module structure could look like. It's going to include the following. We have the library of modules, for example, one of the clinical trial outcomes, another with label information, and so on. We have the so-called master content and rules, a single document with all fragments to be reviewed with rules on how they can be combined. The content is tagged at the master content level. Then we have the channel templates that provide a structure for quick, easy assembly. Module is inserted directly from Viva into predefined template wireframe. And we use that to assemble the final asset in no time whatsoever. In this way, one module accompanied by invisible tags bearing the metadata can be used across multiple channels, like e-detailing, approved emails, and web or landing pages, as we might call them. Of course, the creation of modules should be linked to the possibility of their use across channels. Thus, the habit of proper content planning that is tied to the content production allows to prioritize what modules to produce. To tie it all to the actual customers, actual HCPs, and patients out there, we employ the approach called content stream. At the beginning, there is the target audience, about which we know this and that. Marketing matches this with the key message to deliver and the materials they'll need to convey this key message. After that, the channels can be picked. Content modules are created, then tagged, and the content can be reused in different channels and materials to cater to that HCP, to that audience, to that persona. So here's an example. Let's suppose our target audience is a certain segment of HCPs targeting patients with gastro reflux disease. In this segment, they don't prescribe our product by generally collaborating and requiring most efficient evidence. We have a set of key messages like, our product is efficient according to this and that trial. Here's what the percent is treated successfully, and so on. What we do is we create modules that convey these messages with all the supporting information, references and whatnot, and we can find them in the DAM system using tagging, and then insert them in the templates to create slides, PDF articles, emails, whichever channel we're trying to reach, right? And so on. The really awesome thing here is that we can actually track the performance of the content module by module. And you can see that means essentially message by message down to whatever or not numbers say. 48% patients see a reduction in their symptoms. Does or does not impress the HCP. So it gives us a great analytic response and KPIs to exactly what our content, what's working, what's not working. So we can we can reuse certain things, or we can be able to change it depending on how our HCPs are responding. Now, granted, there's need to be a transition to achieve that sort of content excellence. Like we said, there's no revolution needed though. For example, we at Viseven start with operational audit, then we run a proof of concept project, essentially an MVP, to validate the methodology and tailor it to the individual processes and needs of the customer's organization. Once we have that, then when everyone's ready, we implement it together with the customer. Everyone is ready. That is perhaps the most important thing here. So there's much change management involved, and we're pretty much industrialized this aspect with trainings, courses, onboarding, and so on. Don't be scared of change management. I know we've talked to many people about this change management and they're scared. It's okay. It's part of the process of the digital transformation. If you want to get to the modular content stage, if you want to optimize, you want to reach your HCPs at the right time, change management is key. What we find most convenient right now is an 8-step change management module. From definition stage, where we run an operational audit, look at where we can improve in content-related processes, and present a vision and solution design. Then comes change implementation. Typically with Global Plus, one affiliate, we prepare and validate the platform, set up workspaces, taxonomy, content, metadata, consult, and make sure everyone is comfortable with the process. Only after all of this that we can really deliver and scale the module by onboarding more people in the organization to use it. More markets, more affiliates as a customer orders it. The benefits of an effective change management are considerable. More personalized content, 2 times more of it's distributed in a month. It's produced at 15 to 30% less costs, and time to market is decreased, as well as the MLR turnaround is reduced. In long-term perspective, this is all an evolution of content that is well structured to modular content and then to automated content. At the advanced automated content stage, there is also the possibilities of AI and big data entering the picture with breathtaking possibilities. But even at the plain modular stage, the benefits include modular content strategy, modular content, key messages effective track, MLR streamlining, which I know is one of our questions, and of course, change management. With all of these, our time and cost are reduced significantly. Again, 15 to 30% by doing it right. I know we kind of spoke a little fast. There was a lot to touch. With the MLR approval with our system, just to kind of touch up on some of our questions that we have, understanding modular content, they kind of went through it, but the MLR process of modular content, and I'm happy to show a demo to you specifically, is within our system, you're able to create all these modules, create all this smart content, get it approved. Most of us use Viva, get it approved through Viva. Once it's approved, the module is able to be shared, as we saw before, within all these channels. But when it comes to changing something within that module, our system is able to show the approver through the MLR process, or the legal person says, okay, this has all been pre-approved, but the wording has been changed at this specific part, or the picture has been changed. So that way, the process is so much faster, because now they don't have to read or look at the whole module, the whole entire content, but they can just focus on that specific change and make sure it aligns with everything. And as we talked about during our presentation, once it's approved and it's changed in the module, it's going to be changed throughout all the channels. So hopefully that kind of answers your question just a little bit about the MLR approval, as well as that modular content. I know we had another question here. When modules are assembled into final materials, is it possible to regulate what modules can go where? Make it only possible for it to fit in the, yes. When you create this module, we are able to, especially if you're going from global to local, or even just in your own region, we're able to give you restrictions and allow for that material to be restricted on how, when, and where it could be used, so that way it has that same look and feel, right? So I know for one of our clients, they're only able to change certain things between the modules because it's a business rule, because it's something that we put into place by the client. So the local team is only able to change certain things. Do we have any other questions that we might want to take? Again, I'm more than happy to schedule a time with you as we can do a quick demo on our platform. We can go into more detail on how modular content and what we've done with our customers around the world, because we're actively practicing this right now. It's not just a concept that we've been talking about. We're putting this into play. And we'd love to share this with more detail and understand exactly what your needs as a customer, as a potential client, what your needs are, because everything that we do is very tailored, very personalized to your specific needs. There's not just one mold that fits everybody, right? Everyone's in a different stage depending on the country, the region, but also the maturity of your digital content. So if you're more interested and would like to know more about this, more than happy, myself or anyone on our team. Of course, this is our CEO, Natalia, so you're more than welcome to reach out to her as well. Depending on the region or where part of the world you're joining in this from, we have team all around the world, so we're able to really tailor and understand your needs. I'm here in the U.S., so I work with the U.S. as well as all the time, but we have offices all around the world, so we're always here to help out. Do we have any other questions? Please, if you do, I would love to see them on our question board. Hopefully I was able to really help answer these questions. The align process, Hannah, when we're talking about the align process with our agencies, that's one of the biggest things that we do is we kind of start working with them. We allow, obviously, a lot of you guys have a lot of local agencies that help you with your content and do your content. But by being able to go through our 𝐸-Wizard platform and certifying them to be able to use it, you're going to have that same standardization, that same look and feel. And we're starting to align them so that they're all following the same business rules, or following everything to your needs, instead of everyone doing their own thing. Well, now we have a central point, and they're kind of the umbrella by us as well. So that way we are helping get to this modular content aspect of things. And some of our agencies I know that we work with, or agencies that our clients work with, are a little bit sometimes nervous about modular content, because in return, because you are reusing some of this content, because you are able to localize it at a faster process, they sometimes feel that they're losing out on some profit. But we've worked with so many agencies and really teaching them what modular content is, how they can benefit as well. So we've been through, we've seen it, we've heard it all with our agencies. So this is kind of how we align our agencies with our clients. Hopefully that might have been your question. But let me see here. And I think everything else we kind of touched on. Personalized overnight channel communications. We do that a lot. We didn't touch too much base on that, but some of our past webinars that we've done, we really focus on obviously understanding the clients or the HCPs that you're trying to reach by segmentating, obviously different stages of segmentation, understanding which is the best way or which are the best HCPs to engage in. And from there, just starting kind of creating that personalized content, either being approved emails, broadcast emails, or e-detailing. And then once we have that, we start creating that journey, most of them through Salesforce Marketing Cloud or other tools that you might be using, but really making sure we've had great success. I know one of our case studies, what I'm happy to share, where we accomplished our goal of doubling the registrants on their website. So definitely something that we definitely pride ourselves and work with. I see that we have a few more questions. Yes, Juan, this is being recorded. We'd love to share this with you once I have it. I'm happy to share this link with you, so that way you can listen to it a little bit more. And I'm happy to give you my contact information. Let me put it right here. This is my email. Here in the US, so I'm in Eastern Standard Time, but of course, if you reach anybody from our website at viseven.com, you can find some more case studies there. And depending on where you are in the region, you will be contacted by the account manager, the account executive for that region. But this is mine over here, Juan. I'm not sure where you're calling from, but if you're here in the US or in the Americas, more than welcome to reach out to me here. For Avery, we have experience with Canadian companies. I'm not exactly sure what you mean by PAAB, but I know we actually work with Canada. I know some of my clients are in Canada, so we do understand how it works in Canada. Would love to talk to you a little bit more about what you mean by PAAB. So if you want to shoot me an email, like I just shared it with the group, I would love to kind of understand exactly what you're asking and really answer your question with the right answers and the time that you desire. Anybody else have any questions or concerns? Again, I get very excited about talking about all this because it's constantly changing, really is, all this just digital transformation. And that's one of the things I love about Viseven, that we're constantly learning, adapting to your needs. And if we don't know how to fix it, which we 90% of the time we do, if not more, we'll find a way. We will make sure that we solve your problems here. That's why we're a more tech company, not just an agency. We'll give it another minute to see if anybody else is asking any questions. But again, for anybody that joined us and is heading out, thank you so much for joining us today. Again, my name is Emilio Sanchez. I'm here, account executive for the Americas, based off here in New Jersey. Thank you so much for joining us. If you have any questions, feel free to reach out. Check out our website. We have so many case studies, webinars that we do on almost on a monthly basis. It was a pleasure to talk to you all, and have a great rest of your day. Thank you so much, everybody.